Hi, Dr. Del Grosso at SF Chiropractic. I want to talk to you briefly about traction because you hear a lot about it. You hear about decompression. Okay? Traction and decompression are essentially the same in some ways because they both are types of traction. Okay, the difference is regular traction is just an axial or linear traction that's put on an area of the body, the neck, the low back, and it's a sustained traction. It's there to open up the spaces a little bit, to get some traction there, to open up the spaces, get the pressure off the nerves, and to maintain some stability in there. We can also use that if there's a lot of tension, a lot of tightness. We can use traction to kind of free things up a little bit and give us a better opportunity to help maybe make some changes in the curves or restore the curves. Okay? The difference between that and decompression is a traction as well, but decompression is a computer-controlled traction. Decompression is a traction that actually is traction and then releases. It's traction and distraction are kind of the same thing. So it's distraction and releases again. The purpose of this is if you take your hands, best example, put your two palms together and do this and push, you'll feel a suction. That's the whole purpose of decompression. Decompression is a controlled, like I said, type traction that pulls a little bit and then releases, and then pulls again with a little more pressure and then releases. And it's computer operated, and with this type of traction, what we're doing is actually forming a vacuum in between those segments, in between those bones where the discs are. And the reason for decompression is to what? If you have a disc bulge or a disc herniation, it's to try to take some of that disc material that's pushing out, that's there, and try to draw it back inside the disc. It's very effective if it's done properly and you follow the instructions. Decompression is excellent. Again, it forms a vacuum, it draws some of that disc material, and as we do that though, you have to follow recommendations in order to build that disc strength again, to get the stability in there and everything again, so it doesn't just come right back and do the same thing over again. But if you're recommended decompression for a disc bulge, a disc injury, absolutely best first choice in the world. Okay, a lot of times it can save you disc surgery, it can save you, other more invasive type things just by doing the decompression. Decompression works well. Axial traction works well. They're both for a little bit different reasons, for different purposes, but they both work well. Should they be recommended to you either in my office or somewhere else, please talk to the doctor. He'll explain it a little more to you just like I did, and do it. It's a benefit. Thank you, Dr. Del Grosso.